at the conclusion of the screening, you had some conversation with the patients to draw them out.
Yeah.
Could you talk a bit about what were some of the kinds of skills that you brought to bear and what some of your thinking was related?
Yeah, I mean, I think so often, that we're used to going to a healthcare setting and basically we're being told what the risks are and we're being told what that should mean to us. And what you try to do with motivational interviewing as opposed to doing that is you really want to bring it forth from the client if you can, or from the patient. Mm-hmm. And so in this case, once I explain the screening results and the risk levels, because they need the information, and I asked both of the patients about what that score meant to them. What had they noticed about their risks? And after that, and they were quite honest about it, that these weren't things that they were really considering were that risky for them, but they were willing to consider it. And given that, a technique that's commonly used in motivational interviewing is to ask more open questions about what their drinking is like for them and get a real picture of it. And I would do that through the pros and cons process. So I was really sort of looking for what's working well about their drinking for them and what it means to them, which is in a way, working alongside them. It's a very respectful approach to understand why somebody's doing any behavior. And drinking and substance use fits into that nicely. And not judging them. I think the point is to, people already feel judged about this. Their doctor is sending them in for a substance issue. They already feel stigmatized and judged. And this gives you a 3 on the DAST. And on the audit, we said you got a score of a 12. Okay? So let's see where that places you. So I want to give you this. And as you can see on the diagram, the audit scoring diagram, your 12 has you at risk use. Okay, so I want to give you that. And what that's showing is about 35% of the folks who take that screening tool or come into their primary care doctor's office might have that level of risk.
Okay.
And that I don't know if that gives you any concern.
Well, it got my attention, I'll tell you that, I guess. And certainly, banging my head last night was weird. I've never passed out like this before. That was strange.
Yeah, that was an injury.
Yeah,
that sounds
I
like
guess
it caused some alarm. But what the doctors typically say is that if you drink more than 2 glasses a day, you start getting into this risk category where it can affect things like blood pressure, your heart. People find their sleep can get disturbed. And that's sort of similar, not so dissimilar to your use of marijuana daily. We can talk about that. So I think what would be good to do is you to just know that it's really 14 drinks a week that is said to sort of be the cutoff point for where drinking can certainly turn to be harmful or put you at risk. And you're likely drinking 20, 21, 28.
Yeah.
I mean, and some people it's hard. They sort of forget once they start drinking. And so often we think that they're not good at accurately recalling how much, even though they know. Yeah, but it sounds like you've really, tried to be very honest and clear.
Yeah.
So let's talk about some of the pros and cons of this level of drinking. Most people drink and smoke because they get something out of it. And so why don't we just start there? What are some of the good things that come about with your drinking and your smoking?
I suppose it's, I like wine. I mean, I like it with a meal.
So it tastes good. What else?
I guess I like the feeling. I guess at the end of the day, with the meal, it relaxes me. I like a little bit of a buzz on.
All right. So let me see if I've got that. So the first thing is you really like the way it tastes.
Yeah.
And you said you like to drink wine with your meals. And a lot of people say that. It sort of is like a ritual.
Yeah.
Right? It's something that you enjoy. And the other part is that it does seem to relax you. And I'd love to know a little more about that. How does the wine, do you believe, help you relax?
Well, particularly on the days that I like teaching 3 classes in a row and we've got some meeting that goes on forever. And after all that, I'm just sort of like, I just like want to be done with the day, and I just want to like shift gears. I don't want to be thinking about any of that stuff. And I just want to relax, and just sort of be I don't know, comfortable and I don't know, listen to some music or watch something on TV or.
It sounds nice for you. It sounds like something that you might even look forward to after these stressful meetings, and just to know that this is one way that you have of sort of having everything seem okay at the end of a busy, stressful meeting day, or you just know it's
Yeah,
gonna
it's almost like a reward, I guess.
a reward. Okay, all right. So I'm getting a sense of how it's nice for you. Do we want to, while we're talking about this, let's add the weed in there. What does the weed do in a positive way for you? How would you say the weed adds to this? What seems like a nice meal and conversation with your girlfriend. And
It pretty much does all of that. It sort of pushes that comfort to another level, I suppose. I usually smoke the weed later on in the evening because I'm not going to get too much work done after I smoke on top of, and it's usually like,
all right.
so I'm just sort of kind of vegging out at that point, I guess.
So it increases the effect. And what else would you say if we have a good list of the pros? Are there any other cons that you've noticed besides the injury that brought you in to the practice today?
Yeah, I nod out. I can probably fall asleep easier. Occasionally I nod out,
Right.
on the couch or something, which annoys my partner.
All right.
Yeah.
So that can get us into the cons. And you just use the word, it annoys your partner. What is it about this, daily ritual, this sort of routine that annoys your partner?
Well, I guess she feels like I'm not as attentive to her. I think that was your word, as I could be. Yeah, and I think I think that's pretty much what she said.
Okay. Any other personal reasons or other concerns that these substances have caused you? You have a pretty long history with them. And
I've never had any like DWIs or any of those kind of things. I'm always careful about that kind of stuff. My doctor has been sort of on my case about losing weight. And I'm sure that, 3 or 4 glasses of wine a night is not helping that cause, And I guess I know that after I've had a couple of drinks or smoked, I'm not feeling like going out and like doing something real active. And I got this gym membership, and I usually get there on like Saturday and Sunday. But I mean, at least I think about it'd be nice to be there like more like 4 or 5 times a week and take off some of this weight. But I really haven't done much with it, to be truthful.
if you were to just think about what we just went through, the list of concerns, given the injury last night, given your doctor's concern and the scoring of these tools, which definitely has you in the harmful use category, harmful to your physical health, I want to ask you a question about how motivated you might be right now to take a look at these things and make some changes. So 0 being not ready, 10 we can use, 10 being very ready.
Oh, God.
Where do you think you are in terms of your readiness to make an appointment next week, come in and see me, maybe set some goals around this and start taking some action to shift it to the low, the no risk use, which, by the way, is not probably that far off from you. I think the weed is one that would probably be really significant, but the 2 versus 3 a day, if that's what you're having in the wine.
A 5 or a 6, I guess.
I would have pegged you sort of in the middle, like you're saying, but I'm curious, what is it that had you say a 6 or 7?
I guess I gave myself a 6 because I mean, I'm 49, and I'm not a kid, and I know I'm not invincible, I guess. And this was weird. I mean, I've never like fallen out before. That was just like that was weird.
So this was a bit of a wake-up call.
Yeah. The bang to the head was strange. And I like my girlfriend. I'm not dumb, and I know that if somebody's saying I'm not paying enough attention to her, if I don't do something about that eventually, that doesn't go away. And so, I like being with her, and I don't want to mess that up.
So given that, in your words, it's a wake-up call, and that you're somewhat highly motivated to make some changes, what can you do in the next week before we set an appointment? I want to set an appointment to see you next week, but what could you do between now and then to try to set this on a course where you're lowering your risk some?
Yeah, I put one thing at a time. How about I know I can cut back to just 2 glasses of wine a night. I will think about, and I'll do something, but I don't know what. I got to think about it more, about the weed.
So it's great you want to bring this down. And what we find is a lot of our patients use resources that are helpful for them, like their cell phones, and they put little reminders on there just so they can look at their calendar before they go to bed and say, oh, did I drink more than 2, or how many did I have? Mm-hmm. There's also apps that you can go online and download that make it actually easy, and they sort of give you fun targets, and they might actually make it fun for you. And I don't know if you're into all that.
A little bit.
We're also going to give you a chart that shows some of the harmful effects of alcohol at the risk category of which you're drinking, and the tool showed you. Well, I'm looking forward to working with you.
Okay.
Good luck.
Thank you.
Take care. That's it. I think you really want to have a non-judgmental conversation, and the MI techniques allow you to do that and sort of create a process that's moving forward towards change. Mm-hmm.